Hi, everybody. Welcome to week 4 of the semester already. This week, we're going to shift our focus from a discussion of health systems and financing and understanding the complexities of the system that we are working in and kind of how we got to this point. We're going to shift our focus from that to one of leadership and quality and safety. As many of you have aspirations to be in healthcare leadership positions, this is just, we're going to cover the tip of the iceberg here this week in terms of some of the resources that we can start thinking about and how we should be thinking about healthcare leadership and how our decisions impact the broader system in which we work. Now, before we kind of get into some of the additional content and my suggestions for this week, I'd like to walk through very quickly this notion of management versus administration. I sometimes get this question, especially since our program is titled an MBA in Health Services Administration. What's the difference between a healthcare leader or manager and an administrator? And I would say by and large, probably 80–90% of people working in healthcare use these terms interchangeably. So I definitely would not get caught up in the differences of these. At a very, very high level, healthcare management tends to be something that your C-suite is doing, looking at the strategic direction of the healthcare system, looking at system-wide performance and financial metrics of the organization, where in many cases, the notion of the healthcare administrator tends to be on kind of smaller scale departmental operations. That is when you do some research, that's how most people kind of categorize and define these two things. But again, most people use them interchangeably, so I wouldn't get caught up in that. In fact, the Bureau of Labor Statistics considers anybody who works in any sort of administrative or managerial capacity under the context of the same blanket occupation, which is medical and health services managers. So, okay, doesn't matter, right? Healthcare manager, healthcare leader, healthcare administrator. Again, the work that you're doing really should all, irrespective of the level that you're doing it, should be aligned with whatever the strategic objectives are of the organization. And you should try to snap in even the things that you're doing at a very local level into that bigger mission vision statement and making sure that every decision you make upholds the values of your organization. We're going to come back in a little bit to that because culture is so key in terms of your leader, being an effective leader and being able to really shift the culture within your organization, which is a big job, but it is the role of the manager, the leader, and the administrator. So one of the first challenges we have as an administrator is a research challenge. We know that there are several areas across the country and in New York State, as many of you found in your first 2 discussion posts, where we do have some very serious staffing shortages. So just to kind of break out some of these, in the operating room, we know that surgeon recruitment's really challenging, especially in rural areas. And as we start to see consolidation and mergers and acquisitions happening, this is becoming more and more difficult, and even not just for rural locations, but across the board. Certified nurse anesthetists in the operating room are really well paid. So if you're not familiar with the role, a CRNA on average in New York State makes just above $200,000 a year. And in just the past year, because of major resource shortages, the CRNAs have been across the board coming in, their salaries have increased by almost 30%. So that is a big shift for somebody who's managing a budget for a perioperative operation. And of course, in the operating room, they're dealing with the same nursing shortages that really everybody else is as well. In primary care, we know that, again, from the work that we've done already, that we tend to see people specialize for various reasons. And we do tend to see that a lot of individuals don't opt to go into primary care, which really does create a barrier, and it creates challenges for creating accountable healthcare organizations, patient-centered medical homes. Really, primary care is fundamental to the success of those, to the success of our population health efforts. They hinge on primary care, and we know that we have a lot of staffing issues there as well. In long-term care, we know that nurse aides, we've got a major shortage there. So there have been some creative ideas that people have had in the past few years about creating legislation to have family members kind of help in that capacity and actually get paid for it. And then basically nursing across the board. There are very serious nursing shortages. And this is what our discussion this week is going to focus on, especially with the upcoming mandate from New York State that everybody receive a vaccination by the end of this month. This is going to take an already kind of dire situation and just make it worse. So this is, I'm going to also come back to this. If you don't receive Beckers Hospital Review, it's something that from what I know, a lot of the administrators that I've worked with in the past, you can just sign up for it and you get daily emails. You don't have to look at them often, but it's nice to have something in your inbox every day to give you a breakdown of kind of what's happening across the nation, what challenges are happening. Obviously over the past year and a half, it's been very COVID heavy, but aside from COVID, the biggest issue that comes to the forefront in these newsletters are the staffing shortages. So if we look at this just came out yesterday. So a breakdown of COVID by state, and then items number 2 and 3. So 2, Texas hospital faces closure over vaccine mandate. We are going to see this same challenge in New York State this month. And I'm really looking forward to your discussion post about strategies that we can employ to try to not just get employees to get the vaccination, but how do we create a culture that's supportive and isn't so adversarial. Henry Ford closes 120 beds due to staffing shortages. So this is across the board. Hospital administrators are, receiving the same content, and it really gives you a good picture and some insight into what's happening across the board. Henry Ford is an awesome health system in Michigan. I've worked with them personally. They employ a lot of kind of lean process improvement, very progressive kind of ideas, and have made advancements in a lot of areas of their care delivery process. So to see that they're closing that many licensed beds due to staffing shortages is very surprising. So this week, we are going to talk quite a bit about what was once the triple aim. And this was identified by the Institute of Healthcare Improvement in the early 2000s as kind of the guiding light or the true north for healthcare leaders, right? We should be focusing on population health, per capita cost, and experience of care. And as we see a lot of the decisions we make, we feel some tension between all of these pieces, right? So the investments that we're making into population health through patient-centered medical homes can be expensive. The long-term impact will probably be lower per capita costs, but upfront there will be some cost to kind of get the system set up in functioning as it's intended with interoperability across the electronic health records. So there are some challenges early on that we need to overcome to be able to get to that piece. And of course, with the goal of providing exceptional patient care. But when we're thinking about these opportunities and challenges, we always have to kind of consider the short term versus the long term and use evidence to help guide that decision-making process. The goal, of course, being to improve all of those. So over the past decade or so, though, we've transitioned away from that notion of just the triple aim to being one of the quadruple aim and bringing in care team well-being, joy in work. If you follow any of the Institute for Healthcare Improvement work, you can go to their website, and there are a ton of resources on improving culture, creating joy in work, how to improve staff satisfaction, because we know that, again, as we're thinking about how we're going to do all of these things, provide better patient care, look at really population health and drive down costs, people are getting burnt out. We know that the burden on physicians, on nursing, on all of the clinical team members across the board has been tough over the past couple of decades. And certainly the past year and a half has made that exceptionally challenging. So I want you to really think this week about culture, about leadership and outcomes. There is no shortage of literature and research to suggest that there are very clear links between reports or measures of culture in an organization and similar kind of reports and characteristics of the leaders that run those organizations. And there are also very strong links between culture and patient outcomes at the system level. So there was an article in the British Medical Journal from a few years ago, and they really did a big kind of systematic review of all the literature in this space, looking at over 2,000 different articles, and found that overall positive organizational workplace cultures were consistently associated with better patient outcomes, and specifically associated with reduced mortality rates, falls, hospital-acquired infections, and increased patient satisfaction. And some research that I'm working on right now as well supports that too. We can look at Glassdoor employee reviews and see that that is significantly and positively associated with CMS quality metrics for those same organizations. Whoops. So I want you to start thinking about your leadership style. Think about the sense of a culture within your organization. In my early conversations with many of you, you've identified that maybe there are some things that are missing, and that's kind of your motivation to get the MBA and to step up into a leadership position, as you want to be a part of the change and creating a stronger, more supportive workplace culture. And we know that when we do that, we see improvements in the patient experience, but also, right, if we think about the quadruple aim, we are seeing major changes in employee and staff satisfaction, which again, if we go back to kind of the crux of what we're seeing right now, is these staffing shortages have the potential to close otherwise very healthy healthcare systems. And of course, you know, when that happens, it's not just the organization that suffers, it is the entire community that's relying on the health system for access to the care that they need when they need it. So I want you to think about your leadership style as you continue to get opportunities to step into these positions. We hear a lot about EQ. You know, there was growing up a lot of emphasis on kind of this our cognitive ability to be a leader, which is our IQ, right? But increasingly, there's been this shift toward EQ, which was in large part credited to Daniel Goleman and his book on emotional intelligence, which came out in 1995. And, you know, in the early 2000s, it really caught on, and we started to see and hear a lot of people talking about emotional intelligence. Now, emotional intelligence is really our ability to look at a situation objectively and understand from the other person's perspective where they're coming from, and working to meet them where they're at. And again, as we think about these mandates that are coming through at the end of September, this is critically important. So really start to think about your emotional intelligence. And if you haven't had an opportunity, do some digging. There are plenty of tests and some very, you know, kind of short articles and resources out there that can help you start thinking about, how do I practice on building up my EQ? And this week, we'll also talk about something called character strengths. So while emotional intelligence really came to the forefront in the early 2000s, around that same time, this notion of character strengths. So not just how do we you know, kind of present ourselves and help support some challenging conversations and situations, but how do we, aside from that, how do we think about the things that really motivate us and make us tick? And a lot of these are personality traits that are, you know, that come from either our parents biologically or our environment growing up, right? It's, you know, are we curious? Do we have this like insatiable appetite to learn more and to continue our professional development? Do we have a love of learning along the same lines? Do we see beauty in nature and transcendence, right? Are we religious? There are certain aspects, and there are, per the VIA Strengths Character Finder, there are 24 different categories that we can look at, which we tend to see people really kind of, there are usually one or two top character strengths that really fall high to the top of the list, and then we kind of see a gap and see the other ones. So this was in large part driven by somebody named Marty Seligman. He is a famous psychologist and professor at the University of Pennsylvania, and he's got some great stories and TED Talks. And he, for a long time, was kind of a very traditional psychologist that focused a lot on, you know, when things go wrong, what are those underpinnings that kind of created that situation, and kind of really reframed his thinking about it, and has started a discipline of positive psychology and understanding not just what are the root causes of something going wrong, but what are the root causes of success and joy, and how can we channel those strengths to kind of put us in a position where we are making decisions that are going to align with our strengths. And when we do that, we see that performance improves, we have more satisfaction in work, and we tend to come across as being better partners and better leaders to those that we're working with. I would also suggest for those of you that are on Instagram to follow Adam Grant, who is an author. He is a professor at the Wharton School at University of Pennsylvania as well, doing great work. He has a number of best-selling books out, The Originals, Option B with Sheryl Sandberg, and most recently Think Again, which is exceptional. If you have a chance to read and like to read for fun, I would strongly suggest that, especially with kind of a lot of the challenges that we're currently facing. I would also follow, if you are on Instagram, Harvard Business Review. So just yesterday, this was on my feed, and what came through was, how do we go about getting our joy back at work? Research tells us it comes from taking advantage of our strengths as well as being courageous, authentic, grateful, and connected. So again, trying to put ourselves in the position where we're just getting these things in our daily feeds, whether it's on Instagram or in our email. These pieces that are coming through for us are going to help you start thinking about this on a more regular basis and drawing connections between what you experience on a daily basis in your roles and the literature and the research that's being done. So a great thing about both Adam Grant and Harvard Business Review in Instagram is that usually down here where they have kind of the comments in the description of the post is they'll include the actual research or the cite the source that was done and provide additional details about the methodology. Two other options that I would like for you to consider too is signing up for Beckers Hospital Review, which we had just talked about, and something called Modern Healthcare AM. Again, these are just going to come to your inbox, and you can choose to delete them if you don't have time to look at them, but sometimes it's nice just to glance at the headline so that you can kind of keep a pulse on what's going on in the industry. As always, if you have any questions about the content, please don't hesitate to reach out, and I genuinely look forward to your discussions this week. Have a great weekend.